Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi ta'ala wabarakatuh. My name is Bibi. I'm one of the co-founders of Club Heals together with Dr. Radiah. So I'm here to present a paper on developing the foundation of community mental health for Muslims in Singapore. What is Club Heal? Let me first introduce Club Heal. Club Heal is an acronym for Hope, Empowerment, Acceptance and Love. It is a voluntary welfare organization founded in 2012 in my very own home, and the aim is to support and empower persons with mental health conditions to regain confidence in themselves and others in their journey towards community reintegration. It is the one and the only organization in the Muslim community in Singapore that provides psychiatric rehabilitation and counseling services. Why was Club Heal formed in 2012? Were there any other organizations that provide such services? Yes, there were other organizations, but our organization is a bit unique because we cater specifically for the Malay speaking as well as the Muslim community, even though originally the organization is meant for all. As you are aware that Singapore is a multiracial country, the Malay Muslim constitute 15% of the total populations in Singapore. So we find that there's a need to provide these services to help the people with mental conditions to do both the rehabilitation as well as upstream work. So if you look at the framework of Club Heal, we have 3-tier programs. And the programs, you can see that number one is actually for the beneficiaries. And who are the beneficiaries? Directly people with mental health conditions. So most of them are referred by Institute of Mental Health, and the rehabilitation constitute half a day program. And the remaining day, they will be doing some other enrichment program to help them spiritually, financially, and other aspect of basic human needs. Now, we also provide care for the families and the caregivers of the people with mental health condition, which include the spouse, the children, and the significant others that constitute the caregivers of people with mental health. And thirdly, the bigger circle would constitute the promotion of mental health literacy among the general public. So, for example, Dr. Radiah specializing in the clinical aspect, and for me, being a school counselor, I'm working with children and adolescents who have mental health issues and their families. So this is where we actually collaborate together to provide a holistic program for the entire Muslim community in Singapore. Now, besides working with the Club Hill, we started with, just as I mentioned earlier, we started in my own home, a humble beginning, but currently we have 4 centers in 4 locations of Singapore. We have one in the north, we have one in the west, we have one in the east, and we have one in the center. So this is where we are doing a lot of outreach and collaboration works. Alhamdulillah, over the 8 years period, we are not just organizing public talks, going to media. We have a strong collaboration with media, local media. We have done quite a number of publications. We have done trainings. We have developed Healing Voice to develop volunteers. We recruit volunteers who can provide services to our to our families as well as the people with mental health conditions. Now, in addition to that, we also do big collaboration with local mosques. We have about 73 mosques in Singapore, so we have collaboration with the mosques. We have collaboration with the local madrasas. Now, but madrasas are different from our school because the mainstream schools, they're under the secular system. The madrasas are run by the Wakaf, organization, the Wakaf, and the MUIS, the Council of the Muslim Council in Singapore. And in addition to that, we also collaborate with the self-help group, We have quite a number of self-help group, ethnic-based self-help group like Mendaki, and we have children homes and MMOs, Malay Muslim organization like Muhammadiyah, Jamia, women organization, Association of Muslim Professionals. These are some of the organizations that we have collaborated with for the past 8 years. Now, in addition to that, as I said, we do traditional as well as social media. We also penetrate into the newspapers, the mainstream newspaper. We managed to get into the um, social media. We are working with various partners trying to educate and empower the community. Now, one of the issue that we have is stigma issue. So this is where sometimes we have the local community believe that when they have mental health conditions, some of them believe that either they, similar to some of the Muslims in other part of the world, they either believe that they have a weaker faith in Islam, or they have some other spiritual issues that they have to deal with. So with publications, we are able to educate our community. Now, besides that, we also do a lot of trainings and road shows. Some of these road shows uh, 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 meant not just to educate, but also to collaborate with the different stakeholders. For example, we work closely with the asatizas, we work closely with the medical professionals, we work closely with the social workers as well as educators. Now, these are some of the training that we have conducted in Malay. We conducted both in Malay as well as English to penetrate into the Muslim community. Now, one of the latest development within Club Hill is what we call shifa program, or in Malay we call it program Keluarga Shifa. Now, this is a wellness program targeting to help the elderly in the Muslim community. Some of them actually experience dementia, so we are also working with the mosque to provide such spiritual program to help the elderly. And one of the latest initiative was to come up with the programs, counseling program to help the Muslim children in the madrasa system. Now, madrasa system is unique because they are not funded by the Singapore government. Our system is very centralized system, our education system. So this is funded by the council, the MUIS, Majlis Ugama Islam Singapore. So with this funding given by MUIS, Club Hill is able to provide professional counselors to go to 5 madrasas and to provide support to these children and the teachers. Now, based on our program for the past 8 years, we realized over the years, more people are coming forward to seek help. We have been able to promote positive help-seeking attitude and positive help-seeking behavior among our Muslim community. If we were to use this as one of KPI in our achievement, yes, Alhamdulillah, we have achieved that. Now, secondly, we are also able to engage our clients and our caregivers. More of them are coming forward to seek help. And more importantly, we have this community spirit where people are willing to come and support one another, including the national organizations. We are able to galvanize the support of national organizations to work with us. Now, besides that, we are also, Alhamdulillah, able to convince the community to accept help via modern medicine and also modern methods. And finally, we are able to work together with mosques. For example, our Association of Muslim Professionals for the past few years have been working with us to raise fund. We have been able, because I'm also a member of the Association of Muslim Professionals, so we were able to raise fund by organizing golf tournament and so on to provide support for for Club Hill. Now, this is one of the pictures to show that Club Hill have gone a long way within 8 years. Alhamdulillah, we have, as I said, we started in my own home, And with that, we are able to have 4 centers. And I would like to end with giving you a preview of our video clip, very short video clip of about 3 minutes. And I hope you enjoy it. Thank you very much. And may Allah bless all of us. Ameen Ya Rabbal Alameen.
I think I became a better person through my illness. It was a journey. It's a reminder for me to see like the beauty in the breakdown or the triumph in the tragedy.
Club Hill was formed as a quest to fill up the gaps in services towards people with mental health challenges and their caregivers. As a caregiver and a healthcare provider myself, I find that there's still a lot of stigma attached to mental illness. A lot of caregivers out there are not empowered, and the community as a whole are still not accepting of people with mental health challenges.
I think I do have family members who've got mental health issues. I do have friends, I do have colleagues, and I've seen how it affects them. And so I understand very intimately, really, what are the issues confronting us and why we need to overcome this.
Bila saya dah masuk Club Hill, saya belajar tentang motivasi ini semua ada hikmahnya lah. Apa yang ada dalam masalah-masalah gini, insyaAllah mesti boleh dapat diatasi ya.
Saya tak ada mak.
Mak dah tak ada, bapa tak ada. Jadi kawan-kawan kat Club Hill tu kita anggap macam adik-beradik, macam keluarga lah.
Thank goodness for my kakak.
Because when I started work, I saw for myself the clients, the peers here, and I see how they enjoy coming here, the little differences that Club Hill make in their lives.
It's very important for people to talk about mental health because to normalize it, normalize it that it's not something strange, it's not something too different. When we don't have acceptance, we have no sense of control.
To feel welcome, to feel appreciated, that to me is love. One thing Club Hill does is Club Hill listen. Solving that problem at the time wasn't what I want. Having someone to share my problem was.
One point of time, my husband, he just committed, he just fall down from the block with my son. Okay, when I came to Club Hill, I found that more people need love. I'm also one who lost the loved ones. I also need love. So when I come here, I get love.
Supporting Club Hill means supporting yourself because Club Hill supports you.
Mental health issues are real, and I urge everyone out there to find out more about it. Do get involved with your hands, your words, and your heart. To people with mental health challenges, we love you. You're not alone.